is Jones, and this is a presentation of my final assignment number 6. It is a collection of the case studies I reviewed and analyzed throughout the course, and this paper is a result of me putting it all together. So I tried very hard to find cases that really presented ethical dilemmas. Each case I have highlights the violation of rights most of us feel we all should have. These cases also exhibit powers of judicial courts you may not be aware of. And all of these cases demonstrate how a difference in opinion may cause a big debate in healthcare. So this first case study, it involves a 17-year-old, a young lady by the name of Cassandra in Connecticut. She was suffering with Hodgkin's lymphoma. She wanted to exercise her right to refuse treatment, and although she's 17 years old, her mother supported the decision. However, the physicians, they disagreed with the patients and her mother's decision, and they took them to court. Surprisingly, the court ruled in the favor of the physician. So what are the ethical dilemmas associated with this case? The patient, as I said before, is only a few months away from being legally able to make this decision herself. So let's say if it was just a few months later and she made this decision, it will be nothing but it will be left up to the doctor to give his advice and advise the patient against making such a decision. However, the case would have never been taken to court because she would have been of the legal age to consent or to refuse the treatment. In cases where a patient is a minor, the decision is usually transferred, or the responsibility is transferred to that patient's guardian. In this case, it was the patient's mother who fully supported her decision to refuse treatment. I disagree with the decision of the courts that ruled in the physician's favor. Me personally, when I become a clinic administrator, I want to work for an organization that hears their patients when they speak and respects their wishes, even if those decisions contradict their medical opinion. So here is kind of like a little map that really shows how legally this is supposed to go. So the patient refused treatment. There's a clinical assessment to decide whether the physician is supposed to decide whether the patient is well enough or competent enough to make this decision. And this decision, she's considered incompetent not because of mental challenges that she has, but because she's a minor. So in this instance, senior opinion should have been sought out, which would have been her mother. Now, in the case if she was declared incompetent, the treatment and the patient, they will treat in the patient's best interest. So if she wasn't able to make that decision or to communicate what her wishes were, then the doctors could decide to do what they felt was best in their opinion. So the right to refuse treatment states that paternalism could represent a failure, which paternalism is which the doctor is forcing their opinion on the patient. So paternalism could represent a failure to respect the patient's right of self-determination, which I feel the patient had. Statutory law states that if someone is not of age, which Cassandra wasn't, such decisions should be made by the patient's guardian, which in this case would have been her mother. If these laws were honored in these circumstances, meaning if they would have followed this chart, then the case would have never gone to court. So my second case involves a patient or involves a mother and the events that happened during child labor. So The patient states she suffered terrible labor pains and she would not comply with medical staff during the labor. Well, the patient stated that she suffers these labor pains, and as a result of those labor pains, it was hard for her to comply with the medical staff. As a result, the patient demanded to be released without consulting with her spouse. So the husband was not there when the patient made the decision. Medical staff provided her with documentation that would have needed to be signed, supporting or stating that she did actually ask to be released from the facility. The patient was released and did deliver at another facility. However, her baby later died. So what are the ethical dilemmas in this case? So the patient states that the medical staff neglected her right to compassionate care, meaning that medical staff did not try hard enough to consider the reason she was being non-compliant. Medical staff upholds the patient was non-compliant and therefore their efforts to treat her were repeatedly refused. Medical staff also stated they honored the patient's right to discharge and released her at her own request. So what are the ethical dilemmas with this case? Outcomes. I don't know if you can see this one. My apologies. Let's see if I can make it bigger for you. Okay. So the court ruled in favor of the hospital staff in this case. They upheld the decision to discharge the patient, but noted she should have been provided an ambulance. But they also could not determine that her being released from the facility was definitely the cause of the baby's death. Alright, and so the most important part. In my opinion, I agree with the court's decision. As a mother, I feel the patient should have addressed the baby's best interest and the medical staff professionalism or lack of should have been addressed at a later time. I also feel she should have consulted with her husband. In a lot of instances like this, they say patients aren't thinking rationally, and if the patient might have just spoke to her husband before signing those forms, he might have helped advise her come up with a better decision. I also feel she should have consulted with her husband in a second opinion before signing the forms. Alright. So what are the legal issues in this case? So the main legal issues in this case are the patient went to court and stated that she feels like her right to compassionate care was violated. This approach to healthcare commits clinical staff to understanding the patient as a person, respecting the patient as an individual, and showing compassion for his or her discomfort. In this case, the patient feels that those steps were not taken while when she was being non-compliant. The medical staff, however, states they were upholding her right to discharge. Now, this right states and holds that unauthorized detention of this nature could subject the offending organization to charges of false imprisonment. So say that if it was later found that, say that the patient was never released from this facility, and for some reason the baby died anyway. The hospital was saying that they released her on that so that in the event that anything did happen, she could not say that it was because they did not grant her wishes. Alright. Okay, so both of my previous cases highlighted cases that disputed ethical dilemmas between the patient and the physician. However, my third case is based off of film Patch Adams, which is based on a true story. And this case highlights ethical dilemmas amongst peers, different professional caretakers and other physicians. So this particularly is about a medical student and the difference in opinion of his professors. Okay. So, in short, Patch Adams was a brilliant medical student attending West Virginia Medical School. He questioned his superior's delivery of care to patients in the facility. So, in this scene particularly, a professor approaches a patient, states the patient is diabetic, all the ailments, the reason why the patient is there, is asking, maybe asking the students the different things they can do to treat the patient. And one thing that Patch didn't understand was why he didn't address the patient as far as, "Hi, Mrs. Jackson," or so. He simply asked in this scene, "What is the patient's name?" And throughout the movie, you will see that during this time, healthcare was kind of lacking that aspect. It was all about addressing the patient's illness. But Patch, he demonstrated a more compassionate approach to patients' care. He challenged some of the rules and some of the facility's delivery of care to inpatients. Okay. So what ethical dilemmas were caused as a result of Patch's strong feelings about the wrong direction West Virginia Medical School was heading? So in this scene, these are just different shots, and they are currently at a hearing. The dean had threatened to expel Patch Adams if he did not fall in line. And Patch opens up an unauthorized clinic for patients that could not be treated at Virginia Medical School. So another aspect of, let's say, patients' right or principle at this medical facility is if patients did not have the adequate insurance, patients were turned away. And in this instance, Patch, he provided a place for those patients to go, and he, in short, what he felt provided a need. No, it was not, say, authorized and didn't pass the different JCO codes or such, but after he opened this, somehow the dean finds out about it, and he initiates the expulsion of him. And this scene is Patch standing in front of the school board and just defending why he opened up the facility and the things he was hoping to provide for the patients when he did so. The school board overturned the dean's decision, and Patch was able to continue his education at West Virginia Medical School. He actually went on, graduated, and he kind of set the tone for like free healthcare clinics in a sense. He opened up a hospital where he basically taught students to treat patients with the compassion that he initiated while as a student in Virginia Medical School. In my opinion, I personally feel Patch's goal to want to improve the patient's quality of life and the approach of healthcare was admirable. Yes, some consider it to be impractical at that time, but I don't see any of his action as being unethical. Yes, building an unauthorized clinic was not legal, but technically it was nothing unethical about what he was doing. I found it hard that he was subjected to the school board's ethics in front of all these people just for being a compassionate doctor. Like, it just shows you how far healthcare has come over the years, because these type of actions are expected during the patient delivery of care these days. So how did my case studies relate to the position I am seeking? I might have mentioned previously, I hope to secure a role as a clinic administrator upon my graduation from the Healthcare Leadership Program. Okay, just a little t-shirt. As a clinical administrator, you have to address patient complaints as well as mediate disagreements amongst the clinical staff, such as medical students and their teachers. Clinical administrators are responsible for many of those involved in patient care, such as those on the front line as patient service representative, to the medical assistants, nurses, and the physicians. So, what are the goals of the type of clinic administrator I hope to be? I long to be the type of administrator that makes sure my medical team is respectful of each and every one of the patient's rights, from their privacy to the delivery of care and to the acknowledgement of their opinion. I feel that clinic administrators in the first case I highlighted with the cancer patient, I feel like that clinic administrator had failed to do that when the physician approached her with his concerns about the 17-year-old decisions. If the patient insisted on leaving, I would have offered the safest measure to do so. I often see patients abruptly transfer the care of their pregnancy as a result of their difference of opinion, which I feel is a right of theirs. A patient's right to compassionate care is one that I never want to take part in violating and or not addressing as a clinic administrator. I want to be the kind of clinic administrator that has a good eye for physicians like Dr. Adams and a good ear for his ideas. And, excuse me. Sorry. I don't know what's going on here.
Cool.
And to conclude, I know saying all of these things are much easier said than done, but like Patch, I want to improve the outcomes and the relationship between the patients and providers I work with. I especially want to improve patient relations in the outpatient setting, which is where I've spent the last 10 years of my life developing in this field.